Welcome to Pharmacology lectures. We are going to start with case studies for sympathomimetics. Now first, which of the following is correct regarding adrenergic neurotransmission? How does it occur? Norepinephrine is the major neurotransmitter released from sympathetic nerve terminals. Yes, it is the major neurotransmitter. Norepinephrine is mainly released from adrenal gland. No, epinephrine is released, not norepinephrine. Tricyclic antidepressant and cocaine prevents the release of norepinephrine from nerve terminals. No. What do they inhibit? They inhibit the reuptake in the nerve terminals when norepinephrine is released and it is being reuptaken. They inhibit this reuptake. Monoamine oxidase converts dopamine to norepinephrine in the nerve terminals. No. Dopamine beta hydroxylase will convert dopamine to norepinephrine. Dopamine beta hydroxylase. Which of the following adrenergic drug is used in the treatment of overactive bladder? Epinephrine, dobutamine, phenylephrine, and mirabegron. In overactive bladder, beta 3 receptors is our target. So mirabegron is the target. Which of the following classes of adrenergic agents has the utility of managing hypertension? Alpha 1 agonist. Alpha 1 causes vasoconstriction. Beta 2 agonist. Alpha 2 agonist. They are located in the presynaptic terminals and they cause release in. They reduce the release of norepinephrine and so lead in low BP. Beta 1 agonists they will cause increased cardiac output and increase renin release. Beta 3 agonists, they are not used in the management of because they are used in overactive bladder. Okay, which of the following is correct regarding responses mediated by adrenergic receptors? Stimulation of alpha 1 receptors will increase BP? Yes. Stimulation of sympathetic presynaptic alpha 2 receptors will increase norepinephrine release? No. Stimulation of alpha 2 receptor on the sympathetic presynaptic will reduce the release of norepinephrine. It will decrease. Now, stimulation of beta 2 receptors increases the heart rate. They are not found in the heart. So this is wrong. They are found in the bronch. Stimulation of the receptors will cause bronchoconstriction. They are present in the bronchus, but they will not cause constriction. They will cause dilation. Next, an asthmatic patient was given non-selective beta agonist. It means non-selective means beta 1 and 2. To relieve bronchoconstriction, which adverse effect would you expect with this patient? Now beta 1, beta 1 acts on heart and it will increase the heart rate and contractility. So the patient will see the symptoms of tachycardia if you give non-selective. A 22-year-old male patient is brought to emergency room with suspected cocaine overdose. Which of the following symptom is most likely seen in this patient? Now, cocaine is what it is. It is an indirect adrenergic agonist. Indirect means it will prevent the reuptake of norepinephrine. Therefore, the increase in norepinephrine, if it is preventing the reuptake, the norepinephrine will increase in the synaptic cleft. This increase will lead to increase in BP, hypertension, and it will not lead to bronchoconstriction and it will not lead to meiosis. It will lead to mydriasis. It will dilate and it will increase heart rate, not bradycardia. A 12-year-old boy with a peanut allergy is brought to emergency room after accidental consumption of peanuts. He is in anaphylactic shock. Which of the following drug is most appropriate to treat the patient? Now, norepinephrine, it has more alpha agonist active effects, alpha 1, alpha 2, and also beta 1. Epinephrine, it has more beta agonist activity. Phenylephrine, it has predominantly alpha activity. And dobutamine, it mainly activates beta 1 and has no significant effects on beta 2. So epinephrine is a drug of choice in anaphylactic shock because it acts on both beta 1 stimulating the heart, beta 2 dilating the bronchioles. An elderly patient is brought to emergency room with BP of 70/60, tachycardia, low cardiac output. He is diagnosed with acute heart failure. Now, which of the drug is most appropriate to improve his function? Now, among the choices, epinephrine, phenoldopam, dobutamine, and isoproterenol. The ideal drug which increases the contractility in the heart failure is dobutamine because it is selective beta 1 agonist. Phenoldopam is a dopamine agonist and it will treat high BP. Okay, the other drugs, epinephrine and isoproterenol, they are non-selective adrenergic agonist and they can cause side effects. Which of the adrenergic agonists is commonly present in nasal sprays available OTC to treat nasal congestion? Okay, decongestant. Now, drugs with selective alpha 1 activity. Okay, for nasal decongestions we need alpha 1 selectivity. In these, clonidine is alpha 2, albuterol beta 2, and oxymetazoline is alpha 1, formoterol is beta 2 and it is long acting. So therefore the choice for nasal congestion is oxymetazoline. Now, a patient who has hypertension, mild asthma attacks, bought an herbal remedy for asthma online. Okay, herbal remedy. He does not take any prescription medicine for the asthma but takes beta 1 selective blocker for hypertension. The herbal remedy relieves the asthmatic effects but his BP seems to increase despite of the therapy. Which of the following drug is most likely present in the herbal remedy? Now, phenylephrine, norepinephrine, ephedrine or salmeterol. Ephedrine and salmeterol, they can relieve asthma but they activate beta 2 and they will cause bronchodilation. However, salmeterol is a selective beta 2 agonist and should not increase BP. Okay, this will not increase BP because it is selective beta 2. But ephedrine, you see, it stimulates the release of norepinephrine and also acts as a direct agonist at alpha and beta ephedrine. Therefore, it will cause the increase in blood pressure. Phenylephrine, you know, it is a non-selective alpha agonist, so no bronchodilation. It cannot be used in treatment of asthma. And norepinephrine is a non-selective adrenergic and it has no stimulatory effects on beta 2. It will not increase any hypertension.